Good morning, guys. How you all doing? I hope you're doing good. Today, I am back with my favorite topic, pneumonia. It's one of the most important topics in ICU and also one of the critical topic that we all need to be very much aware about if we're working in ICU, and especially for all of the nurses. Doesn't matter if you're in ICU or you're in a regular med-surg floor. This topic is very important. So let's start. What is pneumonia? Pneumonia is the inflammation or the infection of the lungs, which causes the lungs to swell, causing the fluid plus pus formation in the lungs. So that is pneumonia. Inflammation or infection of the lungs cause lungs to swell, and fluid and pus accumulation in the lungs. It's very important to find out the root cause, that what causes pneumonia. It could be viral, it could be fungal, it could be bacterial. So the most common one is the bacterial, which is mostly treated with antibiotics and most commonly seen in the hospitals. The other ones, viral or fungal, they have flu-like symptoms and they resolve mostly on their own. So important to find out what kind of pneumonia it is. Next comes the kind of pneumonia. The first one is community-acquired pneumonia. It is mostly caused by staph pneumonia bacteria, or it could be caused by mycoplasma pneumonia. It could be caused by other bacteria like Haemophilus, influenza, chlamydia, pneumonia, or Legionella. You would be seeing that all the providers would be testing these bacteria when the patient comes in with the flu-like symptoms to find out if what kind of bacteria is causing the pneumonia. That when it's a community acquired pneumonia, it could be virus related. When it is virus related pneumonia, we will be testing for RSV or for the COVID. And then the another one is fungi. Hospital acquired pneumonia. It is one of the most serious illnesses than the community acquired pneumonia, and it is mostly caused by MRSA. MRSA, you would see that the patients in the hospital, they would be tested for MRSA. It's a swab that we would be taking for the MRSA to test the patients for the hospital-acquired pneumonia. Other one is the ventilator-associated pneumonia. Ventilator-associated pneumonia, it could be caused by, it is caused by the endotracheal tube. When the patients are on the ventilator, they can develop ventilator-associated pneumonia when they're intubated in the ICU. The next one is the aspiration pneumonia. It is mostly caused by the food. When the food goes into the trachea, and through the trachea, it can go into the lungs, and it could cause aspiration pneumonia. This is also one of the most common kind of pneumonia that you can see in the hospitals among the patients. Okay, so the symptoms. You will see most of the patients, they will come with a symptom of congestion. They will have breathing abnormalities. They will have fever. Usually it's 101 and higher. And they would have coughing, yellow or green mucus, or mostly they will be above the age of 65. So these are the basic symptoms that you would see in the patients when they come with pneumonia. Congestion, abnormal breathing, fever, coughing, yellow or green mucus, and they will be over the age of 65. The doctors, they will order the tests. The most prominent one would be the chest x-ray and the CAT scan of the chest, abdomen, and pelvis to look out for infection. They will order the blood test, the sputum culture. They will also collect the pleural fluid to test for the pneumonia. They would do a gas called arterial blood gas. So these are the tests that would be ordered for pneumonia. They can also perform the bronchoscopy on the patient to find out, to see how much secretions are in, and to clear the secretions out, clear the lungs. So this is one of another important procedure that is performed in the ICU by the intensivist or by the critical care certified PAs during the patients when they are there for pneumonia. So next comes the treatment. So how they're treated with antibiotics, they could be treated with antifungal, depends on what kind of pneumonia it is. Fluids, pain relievers. Antibiotics, you would see mostly they would be receiving Zosyn in the hospitals. It depends on the hospital policy, but I have seen they're treated with Zosyn. That's a broad spectrum. It covers most of the organs. They could be treated with antifungal, they could be treated with antivirals. They're also given the fluids unless it's restricted, and they would be given the pain relievers. Tylenol, Q6 hours for fever control. Coughing is important. You have to check with the provider before taking or administering the antisuppressants, because they want the patient to cough and clear out that mucus. So this is another important factor to check with the provider before giving any antisuppressants. Patients are asked to use the humidifier to liquefy the secretion so that they can come out. Very important is the O2 sat monitoring. You have to make sure that the patient is satting above 92%. If they're not satting 92, or if they're satting less on the room air, it's important to put them on the nasal cannula and vice versa, like going up on nasal cannula, then putting them on the venti mask or non-breather. Very, very important to notify the provider if you see the decrease in the SAT. Especially for the patients who are on the ventilator, they might require going up on the FiO2 to make sure they're satting greater than 92%. Prevention is very important. Pneumococcal vaccines. It's important to educate the patient about these vaccines, to get these vaccines given above the age of 65 and above the age of 65, and plus the COVID vaccines to prevent pneumonia. Let me know, how did you feel about the topic? If you have any questions, comment below. I would be happy to help you. Thank you.